And welcome back to Newsmax Now. I'm John Bachman. Ohio Governor John Kasich ridicules a GOP pledge to repeal President Obama's signature health care law, the Affordable Care Act.
They told you in 2014 they were going to repeal Obamacare. You realize that's a big joke. We've got all these conservatives, all stirred up and angry because, they didn't keep their word. I mean, what a stupid promise. And then you got the base of the party is furious because they didn't repeal Obamacare. How are you going to repeal Obamacare when Obama's president?
Well, Kasich made those remarks during an appearance on a Wisconsin talk radio show ahead of that state's primary on Tuesday. While serving as governor, Kasich expanded Medicaid coverage under the Affordable Care Act, angering many Ohio Republicans. Now we're going to talk about Governor Kasich's comments in just a second, but right now, let's bring in Newsmax Health editor and New York Times best-selling author of the Obamacare Survival Guide and the Baby Boomer Survival Guide, Nick Tate. Great to have you with us. I also want to get your take on these recent medical information hacks, these hospital systems. But first, Ebola appears to be making a comeback. There is some concern now about Ebola. Officials say a 30-year-old woman has died from the virus months after Liberia was declared Ebola-free. More than 11,000 people died over the last 2 years from Ebola, most of them in West African nations. It also affected a couple of American aid workers. Nick, are we going to see a repeat of what we saw last summer with Ebola?
That's certainly the fear. In fact, in addition to this death, the CDC just today is reporting that there have been 6 other confirmed cases of Ebola in West Africa and 3 additional probable cases of Ebola. And the initial lab results show that the strain of the virus is either related to or the same as the one that was part of the 2014-2015 outbreak. So the Ministry of Health in Liberia is saying, don't panic, this isn't a big deal, we believe these are isolated cases, but I think that's absolutely wrong. We need to throw everything we can at this to make sure that it doesn't become the big flare-up in the outbreak that we saw last year and the year before.
Yeah, the CDC meeting today to talk about the Zika virus. I would imagine this would come up in the conversation, too. I also want to get your take on these recent cyber attacks, the one at the MedStar Georgetown Hospital in Washington, D.C., a big deal. The hospital's computer system crippled by the virus, forcing them to go back to paper records, and apparently even employees there couldn't use their email. Also, he told me about a California hospital that had to pay hackers $17,000 in ransom to get their information back. What is going on here?
Well, the reality is that medicine is becoming increasingly digitized. Under Obamacare, there has been pressure and a lot of money spent to turn paper records into electronic medical records. Now, advocates of electronic health records say there's a range of benefits. They give doctors instantaneous information about patients. They help prevent things like prescription drug errors. And they create these databases that allow doctors to come up with best practices in medicine for a range, diabetes, heart disease, and cancer, a range of health conditions. But they also make patient information more available to hackers, so-called ransomware hackers that can introduce a virus into a hospital system and essentially shut it down, which is what happened at MedStar and the LA hospitals. So,
they try to do this too fast, implement this too fast under Obamacare, a lot of pressure to get this done?
Well, according to computer security experts, hospitals are vulnerable. Banking systems, credit card systems, even those are breached from time to time, but the firewalls are very high on those. With computer systems at hospitals and healthcare systems, they are not yet at a point where they're really protected, and that's why you, as a consumer, need to take your health records and treat them in the same way that you do your bank statements, your bank records, and your credit accounts, because we are indeed all vulnerable.
All right, so check your credit report.
That's right.
And also tell me why this type of information is 20 times more lucrative to these ID thieves than your financial information.
Cybersecurity experts say that hackers can take this information, medical ID thieves, and they can use it to file fraudulent claims. They can defraud Medicaid, Medicare, your insurance company. They can buy drugs, painkillers, and then resell them. There's a range of ways that these documents become far more lucrative and far more financially beneficial to those black hats that are working. So you need to really guard against that and become a savvy consumer. Protect your records. Ask for your health records from your doctor so you can see what they look like. Check your credit reports, because the fraudulent claims will show up there.
All right, make sure you check out newsmaxhealth.com too, because I know you'll get some more of those tips on how to protect your information, which is really valuable to these hackers. That'll be up later this afternoon, if it's not up already. Also, let's talk about John Kasich. We heard him blasting Republicans for promising to repeal Obamacare. I guess he's not wrong. I mean, maybe not the most artful way of saying it, but...
Well, he's not going to make any new friends in the conservative base of the Republican Party by saying this, but I think he has a point. As long as President Obama is in the White House, he's not going to sign legislation that would repeal what he regards as the signature achievement of this administration. In fact, House Republicans have voted 62 times to repeal Obamacare as recently as January, and the president has vetoed that law and many of the others. Now, John Kasich clearly, it seems to me, is not only kind of shaking things up on Obamacare. I don't think this is going to hurt him with what he regards as his base, which is the moderates, the people in the middle. And it suggests that he may be aiming at some of those middle ground voters who are kind of on the fence and are not really in the conservative side of the party. And in that way, he may be putting pressure on Cruz and Trump and Hillary and Bernie and their positions on health care, which are all very different.
He has only one state, so it's kind of maybe a little state to look past the primary to the general election.
You might be right. Absolutely.
Time will tell. All right, Nick Tate, as always, and remember, if you want to check out those tips on how to protect your medical records, if they are digitized, go to newsmaxhealth.com and check out Nick's article today. Great to see you, Nick.
Good to be here, John.
Thank you. We got more coming up here on Newsmax Now. We'll lighten the mood a bit with some of the best jokes from last night. Who is in the firing line of the late night comics? Plus, we want to hear from you. What do you think about anchor Wendy Bell's comments about young black men? Did it deserve to get her fired from her TV station? We'll hear what you had to say coming up after this.